All right. Next, we'll be hearing from a panel on health equity. Halcyon is focused on health as a core vertical of their work, empowering entrepreneurs across the United States and the globe. These ventures leverage tech to improve physical and mental health care outcomes and reduce barriers to quality, affordable healthcare. Earlier this year, Halcyon welcomed its first health cohort with founders who work in telemedicine, remote patient monitoring, medtech, femtech, preventative medicine, age tech, and more. Let's hear what the next panel has to say about increasing health equity for us all.
Good afternoon, everyone. Hi, I know we are the after lunch panel, so stick with me. I have a wonderful array of world-class experts up here on the stage. We are going to be excitingly talking about health equity and innovation related to health equity and technology. So I'm Nicole Kelm. I lead Deloitte's Health Equity Institute. You can think of that as part corporate philanthropy, part think tank, part internal consultancy for our firm. And I am joined by...
Good afternoon, Orriel Richardson. I'm the head of policy and advocacy at Morgan Health, which is a business unit at JP Morgan Chase, devoted to the 180 million Americans who receive their health insurance through work.
My name is Diana Sierra. I am the CEO of Bigirl, a company that works in the space of menstrual health. As you can tell from my accent, I'm very Latino. I'm also part of the Halcyon first cohort and super happy and honored to be here to share the experience and we have been doing in the space of mental health.
And amazing to be here. My name is Freddie. I am the head of global social impact at Hewlett Packard Enterprise. We're an edge to cloud company. The company split from the HP that you knew. So on one side is the printer and computer business, and my side, we look at hybrid cloud computing, supercomputing. It's wonderful to be here today.
Thank you. So let's get into it. What are the emerging trends in public health, healthcare that you believe will shape the future of global health? And we'll start with you, Orriel.
So one of the things that most employers, which is sort of our core group that we focus on, they're concerned about the cost of being able to continue to offer healthcare benefits to their employees. And I think because of the variation in the types of employers there are, you have your small, mid-sized businesses, which is very relevant to the group of folks in this room, and you have your large and jumbo employers, which is relevant if you are an entrepreneur with a solution that you would like them to purchase in this room. There are just different perspectives on how they have to handle that and approach that. And I think the thing that's really squeezing them is this increase of cell and gene therapies, personalized medicine, the new digital tools that on the one hand could actually cure you from having whatever the disease is, but on the other hand, it could be $2 million to cure you. And at the brass tacks of it, most employers are thinking, if I pay for this 5 years from now, will this employee even still work here? And so we're focusing on a lot of those trends, all in the spirit of making sure that those employers who want to keep offering employer-sponsored insurance understand novel ways to do it, some interesting solutions in the market to help them manage the costs, and also make sure that they're thinking about ways to improve employee outcomes by using some of these data tools and these AI tools to really mine their populations and learn what's going on with their employees and their dependents.
I will say most of the work that we do is in the continent of Africa. And now that you're talking about the future of global health, future is youth. The fact that half of the population is going to come from that continent, it means that all the solutions, whatever, if it's technology or products, they need to be youth-centered, designed for youth by youth to really address the issues that they care about, to make sure that they speak to their needs. In our case, most of the work that we have been doing in terms of creating platforms for educating youth at scale in menstrual health is making sure that whatever we are doing uses the youth as power, as the people that is going out and educating other youth. So I think in the future, what I see is this huge trend, making sure that we address and we tackle these issues from their perspective. And along with that, girls, like honestly, as we see things progressing in the space of menstrual health or like health in general, making sure that we keep women and girls at the center of the conversation, and we design products and services that also speak to their needs.
Ready?
Yeah, I think, and maybe a sad trend is that we see rising costs in healthcare, decreasing customer experience. And for us, it's a sad trend. And then we toss in the topic du jour of AI. And I think we've peeled back the hood on the excitement around AI. At the core, AI needs data. And so we take a look at how can we better collect data, analyze data, derive value from data that keeps the underlying information private and secure? And then how can we use that to really benefit communities? And I think just from HPE's perspective, when we intersect technology with health and the trend there, what's really important for us is how do we as a company keep ourselves honest and develop technology with equity in mind, knowing that sometimes tech solutions aren't necessarily equitable. So that's a trend that we see. That's a trend that we want to correct, if you will.
That makes a lot of sense. Next question is a lightning round question for you all. If there was one word you would want our audience to keep in mind in relation to innovation in the health equity space, what would that be? We'll start with Freddie.
Yeah, well, I think a word came up earlier, which is personalized, and I think personalized and precision is something that that we're going for. And to talk about AI again, I think we believe that if used right, can actually create a more personalized experience if we do it right.
Big if. Deanna, what do you think? What's your word?
Agency. And it's all about agency, building agency in yourself and also help others get that opportunity. Because if we do have the chance to have ownership, just as something as simple as your own body, the fact that you know how it works, that is something revolutionary. And that is something that when you ask these questions, like, what can I leave behind? Work towards that to building your agency and other people's agencies.
Cheating, compound word.
Not authorized. No, just kidding, please.
Sustainably integrated.
Would you like to expand on that?
Yeah, I think when we think about even sort of the startup space, the venture capital space, we think about the philanthropic space, all of those things have a time limitation indicator to them. And one of the things that bears out in health equity is it takes anywhere from 5 to 10 years to really understand how an intervention has impacted population health. And so when we consider the intersection of venture capital, healthcare, technology, innovation, all of those things entering in the healthcare space, they've done so, trying to beat down the door of healthcare because they see this $4.7 trillion that the US spends every year in healthcare. But I think the part of this that they are not necessarily considering is the in and out. It's not necessarily congruent with healthcare. And I have two friends who said two things that I want to reference. One who believes that venture capital and healthcare just do not go together. One who believes that, you don't dabble in healthcare. So if you're going to be a venture capitalist or an investor in healthcare, getting deep in what you're doing is very important to understanding the pros, cons, ROI, and all those things.
That's helpful. So that leads me into the next question, because the themes that are emerging, some of these concepts around personalization, integration, the implication for me there is collaboration. And I used to serve in the US Navy, and we used to have a phrase that we would throw around: everyone wants to coordinate, no one wants to be coordinated, right? So I have a question for you all about coordinating with folks. What role do public-private partnerships play in advancing health equity and innovation? And how can those types of collaborations be strengthened to maximize impact? And I'll start with you, Deanna.
I think that the private sector is amazing in innovating and creating solutions that they're lean, that they're good, but you need government to be able to scale. So in our case, we have designed products that teach menstrual health in a very easy way. But the point that we really make a breakthrough was when the government of Mozambique and the government of Angola took our material and distributed at the school level. So that is us making sure that the private sector, or like we are the ones who can, lead the innovation piece, but we work with governments to be able to scale it and take it to the next level.
That's helpful. Freddie, did you have a thought on that?
Yeah, no, I think part of that is a humility to recognize what we're good at, and humility to recognize where we need others. And so for HPE, we're a tech company, right? We don't really know healthcare. We do know healthcare, but we rely on experts. So as an example, we create supercomputers. I think we're the only producer of exascale supercomputers. So these are computers that can do 1 quintillion operations per second. That's 1 and an 18 operations per second. But we don't just create these technologies for fun. We talk to governments to understand what research needs they have, universities to understand what research needs they have, and then design a system so that we can use it to, reduce the speed of drug discovery. Increase the speed of drug discovery, actually, and improve disease diagnostics. And so I think partnerships in this case, each bringing something to the table and working towards a good outcome is what we look at.
I think they're absolutely essential for meaningful impact in health equity. The data shows that anywhere from 50 to 80% of a person's healthcare outcomes have nothing to do with the healthcare system. So then where are those opportunities to impact those other pieces of the puzzle? And even when you think about sort of the way that the government has Medicare and Medicaid, there's a lot of incentives to do things in those programs, but those people still have the same 50 to 80% of things that are not controlled by those programs. And so even as Medicare and Medicaid are trying to think about how do we really capture the unmet social needs, the social determinants part of this equation in the way that we do our design and financing. And I think those are things that will require, collaboration because again, you want to find a way to sustain these things. And you also want to make sure that there's buy-in. Where we are right now, I think, is everybody's happy to throw money at it for a time, but then you hit that, well, what am I getting for what I'm paying for, what I'm, investing? And we get back to that problem of patient. You have to have some patient capital. You have to have some understanding that it will take a little bit of time to have that bear out. And I think that the more you have synergy between the public and the private sector about these healthcare and health adjacent concerns, it will be this, iterative loop of learning. It will be the thing that over time strengthens the ability of both sides to think about health in the front end of a lot of things that don't necessarily seem health related. So if you're investing in a community like a JP Morgan, you're putting together a deal to put a development in a depressed or blighted community. Thinking about accessibility to a healthcare clinic, thinking about walkability, thinking about a park, thinking about sidewalks. These are some basic things that most of our underserved communities in the US lack, and those are the sorts of problems that can be solved with collaboration across sectors.
That's helpful. What's bubbled up for me listening to your responses is a question around impact, because whether we are talking about equity-centered design or considering the end user in our design approaches or our philosophy around collaboration, patient capital, these types of things, how are your organizations and the innovative solutions you all are working on thinking about the measurement of impact in the work you all are delivering? Who wants to go first?
I can take that one. Basically, in order for us to be able to sell menstrual health, you have to measure the impact that access to this type of things have in people's lives. So for us, it has been the creating the space, education for market creation has been all based on data. So when we started working in this in menstrual health, it was like 10 years ago, and that literally wasn't nobody's radar. But thanks to the work and the diligence that we have been doing in capturing the data and making sure that we ask girls about their happiness levels when they happen to have the right products to go to school, making sure that we can communicate this properly has been the way that to move the needle. Why? Because funders don't fund on things that they don't understand. So if you have the data on hand and you are religiously capturing that impact, then you can go back and say, you know what? Yes, we're talking about girls in school, but like, what are the points that are holding people back to get into those opportunities? Here are the numbers. So that way you can move also legislation, because right now you're talking about creating product standards for these new products to enter the market. So it's all about making sure that you capture the data, but that you can communicate the data in a way that is digestible and also actionable.
Helpful. Freddie, anything you'd add, especially from the perspective of working at a systems change level when we're thinking about impact and creation of impact?
Yeah, there's something that Clayton Christensen said, which I really love. He said, people don't want to buy a quarter drill, they want to buy a quarter-inch hole. And sometimes technologists like to create things. Where I think we try to start from a systems level again is to understand the ecosystem, understand the outcomes that we're trying to drive towards, and then how can we help with that? And I think some of them it's easy to track, right? So can we triage cases more quickly? Can we reduce the time that frontline healthcare workers spend doing paperwork, right? Easy to track, easy to measure. Some things are a lot harder. I wish we could solve Alzheimer's by tomorrow. Probably not possible, but we can track the potential of technology. Are we building it in a way, again, that's more equitable? Are we pulling in the right people, getting the right representation, and then making a dent in the issue in proxy measures that we want to calculate? And again, I think then it's all about being honest with ourselves as we look at where we play in the ecosystem.
Orriel, anything else you'd add there, especially knowing that you have a policy background as well? Is there anything you would add around translating impact out, both in terms of what you were doing in your current role, but also back to policymakers in view of that public-private partnership we mentioned earlier?
Yeah, the bridge that I'm always sort of astonished doesn't exist is when I speak to a lot of rooms that have investors, is there isn't necessarily this belief of the importance of maybe finding an academic partner. Who is your evaluation partner? Who is the entity that has the quantitative, economic, et cetera, background to be able to validate the theory of change that comes with your solution against market dynamics and thinking, sort of prospectively about product market fit? Those are things that are absolutely essential, because you can say, oh, I have this many contracts with this many different Medicaid programs and we're moving and we're growing. But if you haven't been able to, in those touches with those different programs, be able to start to tell a picture of, and on average, our ability to help beneficiaries navigate if they have 2 chronic conditions has meant that they now do not go to the emergency room as much. They have all found a usual primary care provider. They're all logging their A1C numbers to track, and some of them have actually gotten off of insulin or other sorts of forms of reliance for chronic condition management. There is the ability to do that with a lot of these amazing interventions that entrepreneurs are coming up with, but you have to be able to tell the tale, because to the point of what actually can translate innovation and the scale of government to make the next millionaire for good out of this room or this organization is the ability for you to say, my product actually works. Here's the data that bears that out. Here is the way that our academics partners have curated this study such that now you can work with, I don't know, a partner like a Morgan Health, which is an interesting sort of organization with multifunction, a Halcyon, another sort of organization that has an advocacy arm, and start to tell the story of your success and your impact, and telling that to, for example, your local government officials as a start, as a pebble in a pool, and that ripple will go out if you're doing your work successfully. But that research, that rigorous evaluation is so important, not just to demonstrating that someone can invest in you as you scale and grow. It is so that once this amazing intervention that you gave to the world is ready for prime time to be considered to be a part of the fabric of a government program or a government policy, you have done the work to provide them with the narrative that goes along with your solution.
Really powerful. I know we're almost at time, so another lightning round, ding, ding, ding. I will be asking each of you if you can leave this audience of primarily founders and funders/investors with one piece of advice or one thought before you exit the stage today, what would that be? And you all can go in whatever order you would like.
As a non-founder, maybe an aspiring founder, I would say you are brave by virtue of what you set out to do, and continue to exist in that power in every room and space that may not necessarily feel welcoming. understanding that at some point in time, you might have been the innovator that they were looking for just 10 years from now, and just really own the spaces and sit in them.
Very hard to go after that one.
I admire you all.
Oh, no, no. I know that this one may sound simple, but believing that you have what it takes, whatever that is it that you're doing, that you're pursuing, like honestly, look at yourself in the mirror every day, and every time that sometimes you have doubts, and just look at that amazing person in the mirror, and the fact that you are where you are, and then you manage to achieve whatever, going through college, like helping your family, driving a social venture, like just having being a responsible parent, you have what it takes. And that's all that you need. You just need to believe that you have what it takes.
Amen to that. I don't usually dole out advice. So maybe I'll give space to the fact that this month is Suicide Prevention Month. And particularly important, I think, with our discussion on health, because for men in the US, suicide is the 7th leading cause of death. And as a leader, as a founder, as a person, life can be lonely, stressful. And we're all on our journeys, and I'm on my own mental health journey, dealing with perfectionism, anxiety, performance, trauma, and personally as a suicide survivor, I think of how my mental health journey plays into who I am and who I want to be. And so not advice, but an offer that if I know you personally, I do not know you personally, that you can always feel free to reach out and I will always answer, and that you are never alone. In part because of this great community that Halcyon has built, for which I'm so grateful to be a part of. Yeah, that's just an offer that I'll make.
And I will add my unsolicited 2 cents. Keep going. These are not problems of a moment. You know, these are the problems of a lifetime. This is the work of a lifetime. So keep going, keep pushing, not necessarily always in the same way, not necessarily how you think it's going to look today, but keep going. We need your solutions. We need your talent. We need your skill. And with that, we are out of time. So thank you to the fabulous panel. Thank you to our wonderful audience. We are so grateful for your time and attention.